The Southern DHB CEO says 11 men have waited too long for prostate cancer surgery at Dunedin Hospital, with 4 waiting more than 100 days and 1 waiting 191 days for an operation. It comes after a damning review released into the DHB's urology services today identified patients on its waiting list as being at significant risk. It said some patients are 3 years overdue for a follow-up, and major oncology cases, oncology, can wait for 6 months or longer for surgery. Late this afternoon, I spoke with CEO Chris Fleming and asked him to explain the serious clinical events identified in the report.
The mere fact that, as you know, there are 11 patients that have been waiting longer than the expected time for significant procedures in terms of the radical prostatectomies. Any delays can create problems in terms of ongoing care.
Did those delays create problems in terms of ongoing care in some cases?
Look, what I'm told is where a patient with a malignant condition such as prostate cancer has delays in making diagnosis and in reaching definitive treatment, there is undoubtedly a risk of progression of the cancer. This may not present initially, and it may be some time later that's understood, perhaps years after the treatment.
So has this put patient well-being, health, at risk?
It does put patient health and well-being at risk, and we just need to do much better.
You do?
Yes.
It says, key observations, number 2, there is a significant level of clinical risk within the long waiting patients at the Dunedin site. Is that good enough?
No, it's not good enough, and do I agree with it? Yes, I do.
What was the longest wait, Chris, of those 11?
The longest wait is 191 days.
So what's that, 6 and a bit months?
Yes, completely unacceptable.
After diagnosis, after cancer diagnosis?
Yes.
So why has this been allowed to happen?
Well, I think the review document sets out many of the issues, including the serious difficulties associated with the relationships within, particularly Dunedin. It makes comments about the strained relationships between the urologists and senior management on the Dunedin site, but it also articulates the fact that the two services have run completely separately.
I want to pick you up on the relationships, because when the Minister came on Checkpoint, he called the department toxic. Was that fair?
There's been a lot of talk about the word toxic, and I'm going to clarify things for you and also for the public. I indeed talked about a toxic culture within Southern DHB relating to this issue.
Right, so did the Minister get that word from you?
The Minister got the word that I said that it was a toxic culture. That is not, however, to be confused with individuals. We have some great urologists and we've had great managers working within the environment, but it has created problems that have put patients at risk that cannot move forward.
Chris Fleming, who was the CEO of the Southern DHB, that's a shorter version of the interview we ran after 5 o'clock this evening, which is now available online.